So I'm going to be giving furosemide, 40 milligrams every 8 hours. Done our math problem, it's 4 milliliters over 1 to 2 minutes. So I'm going to be checking for the rate of administration. It's going to be giving 40 milligrams over 1 to 2 minutes. Diluted in normal saline lactate D5W. It is a safe dose. It says via the book it's compatible with normal saline D5W. We have D5 hanging, is compatible with normal saline. We're going to be checking for the BP, monitor their BUN levels, renal function, electrolytes, making sure that we would check their heart function, making sure that it's all good for the patient. We would let the patient know not to get up without us because it will cause them to have orthostatic hypotension. We would tell them why we're giving it to them. We would give it to pull their fluid and that it would make them go to the bathroom. That's why we'd be checking their electrolytes. We checking their allergies here. Everything's good. Like I said, I'm going to be giving furosemide, 40 milligrams for 4 milliliters. This is good. This is correct here. Like I said, it is a safe administration. It is safely diluted. Recommended dose, and everything looks good here. So I'm going to go ahead and get it together here. I have a 5 milliliter syringe, which is appropriate. Before I begin here, I'm gonna wash my hands. Okay, and if I had just opened this, I would have removed the safety seal, so I would clean this for 15 seconds. While I'll let that dry, I'm going to have to contain it. The label for my syringe. Okay, so here I would have my patient's name, drug, everything here. I'm going to label it once I have it drawn up. Draw 4 milliliters of air. Make sure not to contaminate. 4 milliliters of fluid. No contamination. I'm going to leave this here. Again, I'm going to put this my patient's name, drug, Lasix furosemide. I'm going to give 4 milliliters. The date that I prepared it, the time that I prepared it. There's no, where it is good expiration date, so we're good there. Now I put my name on here. Label my syringe. And I've checked all the compatibilities and everything here, and I've checked it with what's running in my patient already, so I'm done with this here. I've already done my math problem, so I'm good to go to my patient. So, walking my patient. I'm going to introduce myself. I'm Jessi. I'm going to be your nurse today. We're going to be giving you Lasix. It's going to be pulling that fluid off of you. So if you do have to go to the bathroom, please call me because it will make you feel lightheaded or dizzy, and we don't want you to fall down. Going to be checking patency of my current. Like this. Here, looking at the patient's skin, we're good to go. I'm gonna look at my patient's armband. They can give me their name and date of birth, where they are, today's date. Again, I'm gonna ask them for allergies and see if there's anything here that was not on the chart. And while they're doing this, I'm looking at both order, MAR, and everything's good here. So we would be ready to start. Wash my hands. And since we are giving it in the port closest to the patient, we would put on gloves. We've asked the patient if they've experienced any pain with their IV site, and they say they're good. We've maintained their allergies. We know we're giving everything correctly. While I give this over 1 to 2 minutes, I'm going to be making sure that the patient has no pain experience with this. Oops. I'm going to cleanse my port. (15 to 30 seconds). Cleanse vigorously. Okay. Have this ready to give. Don't touch. Okay. So I'm going to inject 2 milliliters. Unclamp and then count for the additional minute. As I'm here, I'm going to be checking the IV, asking the patient if they feel any itching, any GI upset or any side effects while I'm giving this. Making sure that their IV site stays intact without any redness, that the patient seems fine, and they said that they are feeling fine. Waiting for my full minute. Now push the rest. Withdraw this, unclamp. Remain here with my patient. We'll discard this in a sharps container. Make sure that they don't experience any side effects, that they're feeling comfortable, and then I would leave my patient.